Dave Hiltebittle here again with Pittsburgh Bridges OCD. Today's video, we want to talk a little bit about interviewing your therapist. If you're seeking OCD treatment, even if you're in treatment and you think you're in treatment for OCD, but you don't feel like your therapist is really helping you out, put your therapist to the test. So why am I saying you need to put your therapist to the test? I've had the great pleasure to meet a lot of my peers who live with OCD. And the stories about spending a lot of time, even years, with a therapist who has no training in exposure and response prevention, keep coming. The stories just keep coming. And that's one of the things at Pittsburgh Bridges OCD we're just kind of fed up with. There's a point I wanted to make here. A professional having their credentials says nothing about whether or not they can treat OCD. I'm going to repeat that. A professional having credentials says nothing about their ability or inability to treat OCD effectively. This is a very important point. And so in this video, we're going to talk about how to interview your therapist, how to put them to the test so you know if you're wasting your time or if there's a possibility that you might start to get well here. Unfortunately, some professionals, the honest professionals, will tell you right up front, hey, I don't have a lot of experience with OCD and I know nothing about ERP. And there are honest ones out there. And if you're one of those, thank you. The integrity is what we need more of. But the profession itself is not requiring them to tell us whether or not they have training in exposure and response prevention. Brief point here. Why is exposure and response prevention such a big thing for your therapist to know about and have training in? If you do a quick Google search, IOCDF, most effective OCD treatment. The IOCDF is the International Obsessive Compulsive Disorder Foundation. I did a quick search. You'll find on their site where they talk about the most effective treatment for OCD. It is exposure and response prevention, usually paired with an SSRI. And those are selective serotonin reuptake inhibitors, if I recall. There are some other medications that they might use, but the best therapy that we have is exposure and response prevention. To the point that 70% of individuals with OCD will find relief if they engage in exposure and response prevention. I'm going to say that again too. 70% of us living with OCD are going to get benefit from using exposure and response prevention. You would think, with that being the case, that in order for a therapist to accept a person with OCD as a client, they would be required to have training in exposure and response prevention. Unfortunately, that's not the case. So you're going to have to become your own quality assurance representative. I say quality assurance. I used to work in a restaurant where they had a paid position where somebody would stand there and watch every plate come through the window and check the quality of it to make sure that it was what the people were asking for, what they had ordered. If you're asking for treatment in OCD, you need your therapist to know the number one intervention for OCD is exposure and response prevention. If they don't have that training, it might be time to vote with your feet and walk out the door. Got to be your own quality assurance representative. And I know, when you're sick, when I was really sick, I still have OCD, there's no cure. But this treatment really set me free, and I would say I'm in recovery now. But when I was not well, you don't often have the energy when you're first walking into that room, that office with the therapist. You have this feeling that I want to impress this person. You don't have to impress them. That's my next point that I want to make. Don't be afraid to hurt the therapist's feelings because they work for you. The therapist, your psychiatrist, your psychologist, the members of your treatment team, they are working for you. You're not working for them. You're not there to ensure that they have an illustrious career and a whole bunch of pats on the back for their impressive credentials. You're there to find recovery and to get well from OCD. And if you're not getting well, it could be a couple of things. It could be that your therapist doesn't know what they're doing with OCD. It could be, and this is the other caveat that we'll put here, be honest with yourself. If you have a therapist who seems to be knowing what they're doing, and you've created your hierarchy, and you've started to look at exposures, and you're not honestly giving the full effort, be honest with yourself. Because sometimes it's not the therapist's fault. Sometimes it can be our fault if we're not engaging fully in our treatment program. So be aware of that. Let's see. So, again, become your own quality assurance person. Be sure that your treatment providers have the training that you need to get well, and that should start, in our opinion, with the number one effective treatment for OCD, exposure and response prevention. So, they work for you, you don't work for them. If you're not getting well and you've been with the same therapist for a long period of time, think about changing. Think about changing. Do not be afraid to hurt their feelings. So we're going to go into, I have just a few questions here that could help you to interview your therapist. My friends at Bridges, Ann and Meg, have told me, make sure you ask open-ended questions when you interview your therapist. Because if you give them the in and they just say, if you say, do you know what ERP is? And they say yes, that doesn't mean that they have any training in it. So try to use open-ended questions. So one of the questions you might ask, you know, the first one, if you ask it in a yes or no way, do you have specific training in ERP? Yes or no, we'll follow that up. Where did you receive your training from? Now, I've got two things here. I looked at the IOCDF website. The IOCDF is probably the best that we're aware of training for exposure and response prevention. There are probably some other places, things like the University of Pennsylvania, where I think they first started establishing this for us. But the two that I'm aware of through the IOCDF, they've kind of, it's the same program, I think, but they've got different levels. You've got they call it the IOCDF Training Institute. So see if they have experience with the IOCDF Training Institute or with BTTI. That's the one we talk about the most in our groups. Is your therapist aware of the BTTI? Behavioral Therapy Training Institute, which is the IOCDF as well. So they've added a new level called the Training Institute, which is why I mentioned that. So ask them that. There may be, I'm fairly certain, there are other places where they could have appropriate training. That's the one we're aware of. How many people do you treat with OCD? How long have you been treating people with OCD with exposure and response prevention? How long have you been using that ERP with your clients? Along the lines of questions you can ask your potential new therapist, could you give me some examples of obsessions and compulsions other clients of yours have had? Could you explain to me how you would use exposure and response prevention to treat those symptoms, that experience that the individual was having? See if they're comfortable using that terminology. Things like hierarchy. Do you know how to build a hierarchy with your client? Do you use this? Do you review that hierarchy every so often? Ask them for examples and specifics. If they can't tell you how many people they treat with OCD, if they can't tell you how long they've been using ERP for, even generally, if they're not willing to answer your questions and they act put off because you're questioning their ability, an honest therapist, an honest psychiatrist, an honest psychologist is going to be there to serve you, and they're going to be honest with you, and they're not going to have any problem answering your questions if they know what they're doing. Remember that you've got to represent yourself, because unfortunately there are professionals out there. They've got bills to pay, the education to pay for, and they mean well, right? They might be very nice people, but if they don't have the training you need in the number one treatment for OCD, they might not be helping you. So remember, you're there to get well. At this point, I want to add a plug for peer support. This is one of the huge reasons why I'm putting in a plug for peer support. I was discussing this with a member of Bridges. She told me she'd read on a blog that something like less than 1% of all the therapists in the country have this training that we need. Guess what? If you're someone living with OCD and you found recovery using exposure and response prevention, guess what you have training in? You have training in using exposure and response prevention to get well from OCD, and that experience is something that we can use as a community to lift each other up. We can, if I had to, I could teach you how to do this. we could support each other in doing exposures, and we've done some of that with some of our peers. Together we're stronger. Nothing helps me feel motivated to stay well more than helping others stay well from OCD. We hate OCD, but we love each other and we want to get well. So if you're part of the OCD community and you're in a program or you're with a therapist, ask them for a peer support specialist. Ask them why they don't have one. If you think it would be useful to have one of your peers along to do these skills. We talk about this being a treatment. What this really is an essential skill set for living a life with OCD, because this is what can help you stay in control. Another reason why peer support is such a big thing for me, exposure and response prevention has been around for over 20 years, better than 20 years, and somehow the mental health community still has no standards for our care. Therapists are still not required to have this training, and yet they can still say that they treat OCD. That does us a huge disservice. Such a disservice that I would say it's the poo emoji, right? I'm a little corny. Poo emoji, only not a smiley one. They should have training, and if they're not honest with you, there needs to be standards, but we don't have those. A lot of times we suffer in silence. We may feel embarrassed. That's part of the reason why I'm doing this channel. I've got OCD and I'm not ashamed of it. If we come together as a community, we can get well together. So, I'm starting to ramble. I don't want to ramble. I really appreciate your time. Thank you so much for taking the time to listen to some of these points. I'll be coming back with other thoughts that I'd like to share with the community. And my producer, Ben, what do I need to do?
You need to say the big 3 YouTube things.
The big 3 YouTube things. Like us. Subscribe to us. Ring the bell. Please do that. Especially, I know that a lot of you are personally my friends and family. Like us, subscribe, ring the bell. It really helps us out. We're trying to build a way to reach our peers. And the more of you that join our community, the larger we can build the community and we can start to make progress. Thank you very much.